Most common body parts affected by cramps, and why. It often begins without warning, a sudden tightness, a sharp gripping pain that makes you freeze mid-step or wake in the stillness of night. Muscle cramps, though brief, can feel like your body is being held hostage by something invisible, relentless and oddly personal. For some, they're a rare nuisance. For others, they're a nightly visitor or a workout's cruel aftermath. But have you ever wondered, why here? Why does the cramp always seem to strike the same spot? Why does it feel like certain parts of your body are more vulnerable than others? The truth is, muscle cramps don't happen by chance. They follow patterns, silent logic built on how we move, how we hydrate, how we age, and even how we sleep. And some areas of our body bear the brunt of this more than others. In this deep dive, we'll explore the 6 most common body parts prone to cramps, from the calf that seizes up mid-run to the toes that curl painfully at night. We'll examine the why behind each one, uncovering the signals your body might be trying to send. Because sometimes, a cramp is more than just a spasm. It's a whisper from within, asking for your attention. Let's begin by naming these 6 hotspots, and then, together, we'll understand what they reveal about your health. Calves, the classic cramp zone. It often happens when the world is quiet, late at night, just as you're drifting into sleep. A sudden jolt of pain shoots through the back of your lower leg. Your calf muscle hardens like stone, twisting and pulling with no warning. You clench your teeth, instinctively reach for it, trying to stretch or massage it away. Minutes feel like hours. This is one of the most common muscle cramps people experience. The calf, the thick, powerful muscle at the back of your leg, is a frequent victim of this sudden, searing tension. But why? Why calf cramps happen? The calf muscle group, made up primarily of the gastrocnemius and soleus muscles, works all day long, walking, running, standing, even maintaining posture. These muscles are rich in nerve endings and blood vessels. They're designed for endurance, but that also makes them vulnerable to disruption when something in the body goes slightly off balance. Here are the most common reasons calf cramps occur. Dehydration water isn't just for thirst. It helps your muscles contract and relax smoothly. When you're dehydrated, the delicate balance of sodium, potassium, and other electrolytes in your bloodstream can shift, interfering with normal muscle function. The calf, being active and gravity-dependent, is often first to show symptoms. Electrolyte imbalance. Your muscles rely on a fine-tuned dance between calcium, magnesium, sodium, and potassium. If any one of these minerals dips too low, through sweat, poor diet, or certain medications, the nerve signals to your muscles can misfire. A sudden, involuntary contraction is the result. Overuse and fatigue. After a long day of standing or an intense workout, the calf muscles may be overworked. When fatigue sets in, lactic acid builds up, circulation slows, and the muscle fibers can spasm from sheer exhaustion. Poor circulation. As we age or develop vascular issues, blood flow to the lower limbs may decrease. With less oxygen and nutrients reaching the muscle, it becomes more likely to cramp, especially during inactivity like sleeping. Sleeping positions, ironically, being at rest, can trigger cramps. When your feet are pointed downward during sleep, the calf remains slightly shortened. Over time, that position can trigger a spontaneous contraction. Pregnancy. For many women, calf cramps are an unwelcome companion during the 2nd and 3rd trimesters. Hormonal changes, increased weight, and altered blood flow can all contribute to this phenomenon. Medication side effects. Some medications, particularly diuretics, statins, and certain blood pressure drugs, can deplete the body of essential minerals, increasing the risk of calf cramps. What it might be telling you: while most calf cramps are harmless and temporary, recurrent cramping may be a sign of deeper issues: inadequate hydration or poor diet, overexertion, or lack of stretching, circulatory problems, nerve compression. Side effects of medications. Listening to the body, not just enduring the pain, is key. Wow. You can do. Simple remedies can offer big relief. Stretch regularly, especially before bed. Hydrate consistently. Not just during exercise, eat magnesium and potassium-rich foods like bananas, spinach, and avocados. Massage and apply heat to tight muscles. Wear compression socks. If you stand or sit for long hours, consult a doctor if cramps persist or worsen too. Feet and toes. When the foundation trembles, it may be a small part of your body, but when a cramp hits your foot or toe, the pain feels anything but small. A sudden curling of the toes, a clawing sensation that feels like your foot is locking up from the inside out. These cramps are often sharp, localized, and startling. They can strike in the middle of a walk, while lying down, or even while you're seated at rest. Though less talked about than calf cramps, foot and toe cramps are incredibly common, especially as we age. Why foot and toe cramps happen? The feet are one of the most hard-working parts of the human body. Every step you take requires coordination from over 100 muscles, tendons, and ligaments, many of which are small, intricate, and easily strained. Add in the complexity of nerve signals and blood supply, and you have a region that's constantly under pressure, figuratively and literally. Let's look at the main causes behind cramps in the feet and toes. Prolonged standing or walking spending. Hours on your feet, especially on hard surfaces, can fatigue the muscles in the soles and arches. When overused or undersupported, these muscles can spasm to protect themselves. Poor footwear, shoes that are too tight, lack arch support, or force your toes into unnatural positions can restrict circulation and strain the small foot muscles, leading to cramping. High heels and unsupportive flats are frequent offenders. Cold temperatures, muscles exposed to cold, either from standing barefoot on cold floors or sleeping in a cool room, tend to tighten up. That tension can make them more likely to cramp, especially during periods of rest. Electrolyte deficiency, as with calf cramps, an imbalance of magnesium, calcium, or potassium can affect nerve conduction and muscle contractions, especially in smaller, more delicate muscles like those in the feet. Dehydration. Even mild dehydration can cause the fluid around muscle fibers to decrease, increasing friction and susceptibility to spasms. Nerve compression or neuropathy. Foot cramps can sometimes signal deeper issues like peripheral neuropathy, often caused by diabetes, alcohol abuse, or vitamin B12 deficiency. When nerves are damaged or compressed, the muscles they serve may spasm erratically. Aging. As we grow older, the muscles in our feet naturally lose mass and flexibility. Blood circulation may also decrease, especially in cold environments or during sleep, both of which make cramps more likely. When it's more than just a cramp, frequent toe or foot cramps could indicate poor circulation, especially in smokers, or people with diabetes. Nerve compression in the lower spine. Mineral deficiencies, overtraining or improper footwear, underlying vascular or neurological conditions. Listening to your feet means listening to your body's very foundation. Foot cramps often whisper what the rest of your body hasn't yet shouted. How to prevent and relieve foot cramps. Choose supportive footwear with proper arch support and room for toe movement. Stretch your feet and toes daily. Simple toe spreading and foot rolling exercises can help. Stay warm, especially during sleep. Consider warm socks or a heated blanket. Hydrate steadily throughout the day, not just after cramps occur. Supplement wisely if you're low in magnesium or other key minerals. With a doctor's guidance, massage and soak your feet in warm water with Epsom salts to relax tight muscles. Thighs. When power turns to pain, you may be walking, running, stretching, or even just getting up from a chair. When it happens, a deep, searing pain shoots through your upper leg. It might start gradually, or it might feel like someone twisted a rope tight beneath your skin. The thigh seizes, you gasp, you freeze. And for a moment, all you can do is wait. Cramps in the thighs, especially the hamstrings, back of the thigh, and quadriceps, front of the thigh, are less common than in the calves, but often more intense. They strike hard and deep, stopping movement in its tracks. And unlike smaller muscle cramps, they may linger longer, leaving behind soreness that can last for hours or even days. Why thigh cramps happen? Your thighs are home to some of the largest and strongest muscles in your body. They power almost every movement you make. Standing, walking, climbing, sitting, even just keeping your posture upright. But with great strength comes great responsibility and a higher risk of overuse, strain, or neglect. Let's explore the most common reasons behind thigh cramps. Muscle fatigue, whether you've been exercising hard or simply on your feet all. Your thigh muscles, especially the quadriceps, can become overworked. Fatigue reduces the muscle's ability to contract and relax smoothly, making involuntary spasms more likely. Improper stretching or sudden movement, sudden changes in position, especially without proper warm-up, can shock the thigh muscles. A quick reach, a fast sprint, or an abrupt shift from sitting to standing can all trigger cramps, particularly in the hamstrings. Dehydration and electrolyte. Lost like the calf and foot muscles, the thighs are sensitive to fluctuations in hydration and mineral balance. Potassium, magnesium, and calcium deficiencies can impair nerve communication, leading to misfiring signals and tight, cramping muscles. Compression or poor circulation, sitting for long periods, especially in cramped positions like on airplanes or long car rides, can reduce blood flow to the thighs. This may not cause a cramp immediately, but when you finally stand or stretch, the muscle may respond unpredictably. Aging and muscle loss. With age, muscle fibers shrink and lose elasticity. The balance between muscle tone and flexibility becomes harder to maintain, making older adults more prone to sudden cramps in large muscles like the thighs. Nerve issues. Nerves that travel from the spine down to the legs can become compressed or irritated, especially from spinal problems like sciatica or herniated discs. These conditions may manifest as thigh cramps, sometimes accompanied by tingling or numbness. What your thighs may be trying to tell you. Recurring thigh cramps can hint at overexertion or poor muscle conditioning, poor posture or gait imbalances. Chronic dehydration, early signs of spinal nerve compression, low levels of key nutrients, especially in athletes or the elderly. In other words, when your thighs cramp, they may be calling for more than just a stretch. They may be calling for balance, rest, and deeper care. How to relieve and prevent thigh cramps. Warm up before any physical activity and cool down afterward with gentle stretches. Focus on flexibility. Daily stretching of the quads and hamstrings can keep them limber hydrate throughout the day, especially during hot weather or intense exercise. Strengthen supporting muscles, especially the glutes and hips. To reduce over-reliance on the thighs, use a foam roller or massage the area. To relieve tension and improve circulation, consult a healthcare provider if cramps are frequent or accompanied by back pain or numbness. Hands and fingers. When precision falters, it might happen while you're holding a pen, gripping a steering wheel, or typing a message. One moment your fingers are moving smoothly. The next, they freeze, twisting, curling, or locking into place. Pain surges through your palm or a single digit, as if the muscles are folding in on themselves. A cramp in the hand or finger may last only seconds, but the feeling can linger. A tingling ache, a tightness, a sense of betrayal from a part of your body you rely on for everything from expression to survival. Why hand and finger cramps happen? Unlike the large muscles in your legs or thighs, the muscles in your hands are small, intricate, and delicate. They're designed not for power, but for precision, for writing, grasping, cooking, crafting, playing an instrument, or simply holding someone's hand. That level of fine control requires constant communication between nerves, muscles, and tendons, and it doesn't take much to disrupt that harmony. Let's explore the primary reasons for cramping in the hands and fingers. Repetitive strain typing. Texting, writing, or working with tools for long periods can overuse the small muscles of the hand. Over time, this leads to fatigue, microtrauma, and sometimes involuntary contractions or cramps. Dehydration and electrolyte imbalance. Even though the hands aren't weight-bearing like the legs, they're still muscles, and they still rely on water and minerals to function. Low potassium or magnesium can affect even the tiniest muscle fibers. Cold exposure. Cold temperatures can cause the blood vessels in your hands to constrict, reducing circulation. Less blood flow means less oxygen and warmth, conditions where cramping becomes more likely, especially in people with conditions like Raynaud's syndrome. Poor ergonomics and awkward wrist position while typing, holding a phone too tightly, or using poorly designed tools can lead to chronic tension in the forearms, which then affects the hands and fingers. Nerve compression. The median nerve, which runs through the wrist, can become compressed in conditions like carpal tunnel syndrome. This may lead to numbness, tingling, or sudden hand and finger cramps, particularly at night or during repetitive tasks. Medication or health conditions. Certain medications, like diuretics or statins, or chronic conditions, like diabetes, thyroid imbalance, or kidney disease, can interfere with muscle and nerve function, sometimes resulting in hand cramps. When the hands speak for the body, frequent cramping in the hands and fingers may signal overuse or repetitive strain, injury, inflammatory. Conditions like arthritis, circulatory issues, or peripheral neuropathy, vitamin deficiencies, especially B12 and magnesium. Early signs of carpal tunnel syndrome. Because the hands are used constantly, they often reveal fatigue or imbalance before other parts of the body do. How to soothe and prevent hand cramps. Take regular breaks during long typing or tool-heavy tasks. Stretch your fingers and wrists gently several times a day. Apply warm compresses, or soak your hands in warm water to improve blood flow. Stay hydrated, especially during high-stress or high-activity days. Use ergonomic tools and keyboards to reduce strain. Massage the hands regularly, especially the fleshy areas of the palm and base of the fingers. Wear compression gloves if circulation is an issue, particularly in colder environments. 5. Abdomen. When the core contracts without warning, it often begins as a tightness just beneath the skin. Then, without much warning, the abdominal muscles contract, suddenly, sharply. The cramp may twist across your stomach like a clenched fist or hit one side with such intensity that it takes your breath away. It's not the dull ache of indigestion or the flutter of nervousness. It's unmistakable, a real involuntary muscle spasm of the core. Abdominal cramps can happen during physical activity, after long periods of tension, or even during rest. But unlike leg or hand cramps, which often feel mechanical, abdominal cramps carry a deeper, almost instinctual discomfort. We guard our belly for a reason. It protects our vital organs. So when it cramps, our entire body reacts. Why abdominal cramps happen? The abdominal muscles include several overlapping layers. The rectus abdominis, the six-pack muscle, the obliques on the sides, and the transverse abdominis deep core stabilizer. These muscles not only help us move and stabilize the spine, they also contract during coughing, laughing, deep breathing, and even during digestion. That's why cramps here can feel so intense. They affect breathing, posture, and core balance, all at once. Here are the main causes of abdominal muscle cramps. Overexertion or improper exercise. Form exercises that engage the core, like sit-ups, crunches, planks, or even yoga poses, can sometimes overload the abdominal muscles, especially if form is off or recovery is lacking. The muscles fatigue, and a sudden contraction can seize them mid-movement. Dehydration or electrolyte imbalance. Once again, the underlying theme of hydration arises. Abdominal cramps are common in athletes, particularly runners and cyclists, who sweat heavily and lose sodium, potassium, and magnesium. These minerals are crucial for muscle relaxation, and without them even core muscles can spasm. Prolonged laughing or coughing, it may sound harmless, even silly, but laughing too hard or coughing for too long can tire out the abs and trigger a cramp. The repeated contractions build up tension, and without a chance to relax, the muscles can lock up. Poor posture or tension. Holding stress in the stomach is more common than we realize. Anxiety, fear, or prolonged tension can cause us to subconsciously brace our core, leading to fatigue and cramping, especially in the upper or side abdominals. Menstrual cramps. Although not technically skeletal muscle cramps, many women experience intense cramping in the lower abdomen due to uterine contractions during menstruation. These can also radiate to the abdominal wall, creating a double sensation of pain. What your abdomen might be telling you. Persistent or recurrent abdominal cramps should be taken seriously. They could point to overuse from exercise or poor technique. Gastrointestinal. distress or bloating, poor hydration or low electrolyte levels, chronic stress or anxiety patterns, referred pain from deeper organs like the intestines or uterus, cramping that occurs after eating or that's accompanied by nausea or bloating may signal digestive involvement rather than muscular. How to ease and prevent abdominal cramps? Stretch gently by arching the back like the cobra pose in yoga, or lying flat and breathing deeply. Stay hydrated, especially during physical activity, or in hot environments, practice abdominal massage. Gently rubbing the area in circular motions can ease tightness. Rest and apply heat, such as a warm compress or heating pad. Breathe deeply and consciously. Especially during stressful moments, maintain proper form during exercise to avoid overloading the core 6. Neck and jaw. When tension turns to lock, it can happen while yawning, or while chewing, turning your head, or waking from an awkward sleep. Suddenly, the muscles along your neck tighten like cables drawn too taut, or your jaw clenches, not from anger or stress, but from something deeper, involuntary and painful. A cramp here may last only moments, but the sensation, intimate, close to the spine, face and skull, can feel far more disorienting than a leg or foot spasm. These aren't just muscles, they're muscles close to your nervous system, voice, airway and expression. That proximity makes a neck or jaw cramp not just painful, but sometimes frightening. Why neck and jaw cramps happen? The neck supports the weight of your head all day, an average of 10 to 12 pounds. The jaw, meanwhile, is in near constant use. Speaking, eating, smiling, tensing, swallowing. These muscles are active, sensitive, and deeply connected to stress patterns, both physical and emotional. Let's look at some common causes behind neck and jaw cramps. Poor sleep posture or prolonged. Positioning, sleeping with the neck twisted or unsupported, can fatigue the cervical muscles. Likewise, sitting for hours with the head tilted, like looking at a phone, strains the trapezius and sternocleidomastoid muscles, increasing the chance of spasm. Stress and clenching. The jaw is a common site for held tension. Many people grind their teeth at night or clench the jaw during the day without realizing it. This constant pressure tires the masseter and temporalis muscles, leading to cramping or even temporomandibular joint (TMJ) dysfunction. Dehydration and mineral deficiency. Yes, even here, dehydration and electrolyte imbalance play a role. Low calcium or magnesium can interfere with muscle relaxation, particularly in the tight, small muscle groups of the neck and jaw. Nerve impingement or cervical issues. A pinched nerve in the neck can cause referred pain and cramping in nearby muscle groups. Spasms may be protective in nature, an attempt by your body to splint the area and prevent further movement or injury. Overuse of voice or chewing. Singers, public speakers, and people who talk for hours at a time can strain the muscles of the throat and jaw. Likewise, chewing tough foods or even gum excessively can fatigue the jaw muscles. When these cramps may be warning. Neck and jaw cramps can be your body's way of saying, I'm carrying too much stress. My posture is out of balance. I need rest, minerals, and relief. But they can also, in rare cases, point to neurological conditions such as dystonia or facial nerve disorders. Persistent or severe cramping here should never be ignored. How? To relieve and prevent neck and jaw cramps, apply warmth to relax tight muscles. A heated wrap around the neck works wonders. Stretch the neck gently, tilting the head side to side and forward back without force. Use a mouthguard at night if you clench or grind your teeth. Limit long periods of head-forward posture, especially on screens. Stay hydrated and supplement key minerals if needed, magnesium and calcium. Incorporate gentle massage around the jaw hinges, temples and back of the neck. Learn stress reduction techniques, breathing, mindfulness and awareness all help relax facial and cervical tension. In closing, this chapter, cramps are not random. They are reminders. They tug at our muscles like a knock on the door, a subtle, sometimes painful signal that something beneath the surface needs attention. We've journeyed through 6 of the most common sites, from the calves that carry us to the jaw that speaks for us. Each region, though vastly different in size and function, shares a common truth. The body speaks when the balance shifts. Cramps can whisper or they can roar, but behind each one lies a pattern: fatigue, dehydration, imbalance, stress, poor posture, a medical condition trying to surface, or simply a muscle that has worked too hard for too long, without rest, without notice. They may be brief, but they are never meaningless, so let this chapter do more than inform you. Let it remind you to notice where your body tightens and when. Stay nourished, not just with food, but with rest, hydration, and awareness. Move, but also pause. Push, but also care. Because cramps are not just physical, they're a reflection of how we live, and sometimes how we forget to live gently. In the next part of this journey, we'll dive deeper, beyond locations, beyond symptoms, into meaning, into message. We'll ask, what are these cramps trying to tell us about our overall health, and more importantly, what happens if we finally begin to listen?